Welcome to the MS&Me Radio Network. The broadcast shows are for informational and entertainment purposes only. They are not designed to provide listeners with specific personal, medical, or counseling advice. Individuals with a medical issue should always consult their healthcare provider. MS&Me is not responsible for content of individual shows. The views expressed by show hosts or the guests are their own. Enjoy the show.
I'm John Strum, and this is RealTalk MS. It's October 9th, and we have a lot to talk about. And this week, we're going to be talking a lot about ECTRIMS. The 34th Congress of the European Committee for Treatment and Research in Multiple Sclerosis is the largest MS conference in the world, and it gets underway tomorrow in Berlin, Germany. I'm heading to Berlin, and you can look forward to special episodes of Real Talk MS directly from ECTRIMS tomorrow, Thursday, and Friday of this week. And when I say that ECTRIMS is the largest MS conference in the world, I should probably give you some context there. This year, there are already over 8,600 MS researchers, clinicians, advocates, and pharmaceutical companies from over 100 different countries who are already pre-registered to attend ECTRIMS. Over 3 days, more than 1,600 scientific abstracts will be reviewed and discussed either through presentations in more than 80 different sessions or in poster sessions. And by any standard, that's a lot. Just a few weeks ago, we were talking about the discovery of a new subtype of MS called myelocortical MS. Well, Bruce Trapp, who led that research at the Cleveland Clinic, will be giving an update on that discovery at ECTRIMS. The results of an important trial in the UK that followed 400 people living with secondary progressive MS will be announced. Genentech, the manufacturer of Ocrevus, which has been approved for treating relapsing, remitting, and primary progressive MS, will be discussing 15 different studies highlighting various aspects of Ocrevus that have been identified since its approval last year. There will be important discussions about advances in pediatric MS, the role of cannabidiol-based treatments for managing MS symptoms, and researchers will share their insights on the role of the gut microbiome in MS, the potential benefits of diet in managing MS, new approaches to cognitive rehabilitation. Like I said, this is a large and important conference. And if you haven't already downloaded the RealTalk MS app, you might want to head over to the Apple App Store if you have an iOS device, or the Google Play Store if you have an Android device, and download the app today. Because all week long, you'll receive bonus content from ECTRIMS that will be available only through the app. And we're actually going to start that today. So I hope you download the Real Talk MS app so that you won't miss anything all week long. But while I'm flying from Los Angeles to Berlin, and I hope you're getting ready for a week of special Real Talk MS podcast episodes direct from ECTRIMS, there are a few other things that you should know about. The Accelerated Cure Project for Multiple Sclerosis and pharmaceutical company EMD Serono have announced a first-of-its-kind collaboration to integrate the perspectives of people affected by MS into the design and implementation of clinical trials. This patient-focused drug development collaboration will be supported through iConquer MS, which is a people-powered research network from Accelerated Cure Project, and the collaboration will include the development and validation of patient-reported outcomes in drug development. So to give you a little background, the U.S. Food and Drug Administration defines patient-focused drug development as a systematic approach to ensure that patients' experiences, perspectives, needs, and priorities are captured and meaningfully incorporated into drug development and evaluation. And typically, all of that has been missing from the traditional drug development process, and it can certainly make for a more powerful, more meaningful, more effective development process if people who are living with MS can add their input to questions like, how should a drug's effectiveness be measured? Or what symptoms and quality of life improvements matter most? And given that all drugs pose some risk, what are the risk-benefit trade-offs that people living with MS are willing to make? Well, iConquer MS has created a patient-focused drug development council, and the council will be working closely with the iConquer MS project team and team members from EMD Serrano to ensure that the preferences of people living with MS become part of the drug development process from the beginning. The members of the iConquer MS Drug Development Council were invited to participate based upon their engagement as members of iConquer MS. If you're interested in contributing your insights and experiences as a person affected by MS in order to improve and accelerate MS research, you may want to join the iConquer MS People-Powered Research Network today. And you'll find a link to iConquer MS where you can find out more and register to participate in today's show notes. Last week, the National Multiple Sclerosis Society committed $12 million to fund 40 multi-year MS research projects. One of these projects is a study at Massachusetts General Hospital to develop a way to monitor cells that play a role in myelin repair in people with MS. Another is a clinical trial at New York University testing the benefits of transcranial direct current stimulation to treat MS-related fatigue. And another study is taking place at Australian National University focused on a link between the environment and how certain genes are turned on and off to trigger the onset of MS. Now, this $12 million commitment is part of an overall research investment of over $35 million in 2018 alone. You may not know, but the National MS Society is the largest private funder of MS research in the world, and they've already invested more than $1 billion in multiple sclerosis research. And if you're interested in checking out all 40 of these different MS research projects, I'll include a link to the full listing in today's show notes. And while we're on the subject of research, a research team in Germany analyzed data from 35,755 patients from their nationwide MS registry. And they were interested in identifying which MS symptoms seemed to be most common and which MS symptoms seemed to be the ones most often treated. So within their registry, they found that more than 2/3 of the people were women with an average age of about 46 years old. And their analysis of the patient data indicated that most frequently reported MS symptoms were fatigue, spasticity, and urinary disorders. They found that treatment was most common for spasticity and depression, but only about 1/3 of the affected patients were treated for their fatigue. Well, the research concluded that while overall treatment for MS symptoms has increased over the past 10 years, sexual dysfunction, swallowing difficulties, cognitive dysfunction, and fatigue all remained undertreated MS symptoms. And I'll include a link to that study in today's show notes. $62 million people in the United States alone have some kind of mobility impairment that may affect their hand motor skills. And that certainly includes people living with MS. You may be living with MS tremor, or you may have lost some or even all of your hand motor skills, and that can make even the simplest activity incredibly challenging and frustrating. Well, if you're a regular listener, then you already know that I'm a big fan of so-called intelligent speakers like Amazon Echo or Google Assistant, because they represent just outstanding examples of assistive technology. These devices can turn on your lights, operate the air conditioning or heating in your home, remind you to take your medication. They can make it easy for you to contact a family caregiver or for a caregiver to contact you. Heck, they could even play your favorite podcast. And that's a lot of really useful functionality for a relatively low price. Well, now Google has extended the work that they've put into Google Assistant and created Google Voice Access, which will enable you to easily navigate all through your Android phone completely hands-free using just your voice. You can use voice access to open apps, navigate between screens, and edit text hands-free. You can issue commands like click next, open Gmail, turn on Wi-Fi, and you can turn off voice access by saying stop listening. And if you aren't sure how to get something done using Google Voice Access, you can always get to help by asking, what can I say? Well, Google Voice Access is a free app that you can download from the Google Play Store, and I'll put a link to the Google Voice Access app in today's show notes. Last week, the United States Health and Human Services Department implemented a rule that dramatically expands the availability of substandard health insurance policies known as short-term health plans. In the insurance industry, they're known as junk insurance plans. And we've talked before on the podcast about why these plans are absolutely terrible. In fact, individual states have already started to pass their own laws to protect their citizens from being victimized by these junk insurance plans. They're already banned in New York, New Jersey, and Massachusetts, and just last week, California Governor Jerry Brown signed a bill that makes it illegal to sell short-term health plans in California. These are much cheaper health insurance policies because they cover far less. They don't cover pre-existing conditions. Some of them don't even cover a hospital stay if you happen to be admitted to a hospital over the weekend. They're full of surprises like that. But if you're young and healthy, they have very attractive price tags. And now, although they're called short-term health plans, the Trump administration has lengthened that term from 90 days to 364 days, renewable for a total of 3 years, making them even more attractive to a healthy potential buyer. Now, you might be thinking that since you aren't going to buy one of these policies, they won't affect you, but they will. And to understand how and why, you just have to remember how insurance works. The insurance system is predicated on the idea of spreading potential risk as widely as possible. In other words, among the greatest number of policyholders. That way, insurance companies can provide the best possible coverage at the lowest possible price. The more people in the risk pool, the lower everyone's costs. So up until now, everyone, people who were living with chronic illness and people who were completely healthy, everyone was in the same risk pool. That way, insurance companies were able to spread their financial risk between those policyholders that might have a lot of medical claims and those policyholders who might not have any at all. But that's all going to change because young, healthy people can move into a far less expensive insurance plan. Well, it covers far less, but they're betting that they're going to stay healthy and won't need a lot of coverage. Of course, anyone listening to this podcast can probably tell you that everyone's healthy until the moment that they're not. But that's not how these insurance consumers are likely to see things. So they'll move into a different pool, into the so-called short-term pool. And who does that leave in the other insurance pool? A majority of folks who are going to be filing lots of medical claims. And in order to protect themselves and cover this increase in their financial risk, insurance companies are going to raise their premium rates. Some insurance companies may simply elect not to sell individual health insurance policies in certain areas or states. And that's how all of this is going to impact everyone living with a pre-existing medical condition. And that includes everyone living with MS. So this new rule was adopted last week, and there's already pending legislation that can stop it in its tracks. Senator Tammy Baldwin has introduced Senate Joint Resolution 63, which would prevent this new rule from taking hold. The vote on Senate Joint Resolution 63 could come up as quickly as this week. So if you're listening to the podcast and you live in the United States, please take just 2 minutes out of your day to let your senator know that they need to vote yes on Senate Joint Resolution 63. You can call the U.S. Capitol switchboard at area code 202-224-3121 and ask for your senator's office, where you'll be able to leave a message to your senator. And the message is a simple one. Short-term health plans are bad medicine for people with pre-existing medical conditions. Please vote yes on Senate Joint Resolution 63. And if you're a regular listener, you know that I'm passionate about advocating on behalf of our own best interests. It's the most empowering example of democracy in action. So please take action and be a difference maker in the MS community. Well, that's going to wrap up this episode of Real Talk MS, but don't forget that beginning tomorrow, you can look forward to special podcast episodes directly from ECTRIMS in Berlin on Wednesday, Thursday, and Friday. And if you want to get those podcast episodes with special bonus content, then you'll want to download the free Real Talk MS app from the Apple App Store or the Google Play Store. And we're going to jump the gun by a little bit. You can expect that bonus content to start appearing today with a special video from ECTRIMS. My name is John Strum. Thanks for listening, and we'll catch you next time.